Hi, I have with me Varun from GeBBS and Amar Kulkarni. He's the product manager and Varun is the AVP software. Welcome Varun. Welcome Amar. So Varun will first start with you. Something about GeBBS. How long has been the organization? Your time with GeBBS. How far you have come through in the organization?
So, GeBBS is primarily into providing healthcare services to our US providers, hospitals, clinics, physician groups, and it's been there in the business since like more than 15 to 20 years now. I have been with GeBBS since 4.5 years now, and I have been managing the software development part of GeBBS. So GeBBS has very much, so they are mostly, I would say, providing data entry services like a BPO. They are a BPO, and I'm actually managing their software development, and they are very much into technology innovations around healthcare products. So I'm looking after into their product development along with my team in US, who are also interacting with a lot of clients over there and providing us guidance and the requirements for development.
Amar, how long you have been the product manager with GeBBS?
So I have with GeBBS 4 year, okay, and working with Varun closely into software department, and the specially focusing on the requirements, requirement gathering, analysis, then defining the product layout structure that will enable to the software team to develop a product and which can be catered to in-house users as well as to the clients. And because the requirement are the core, you can say a backbone of the application, because that is a starting point. If that starting point is not adapted accurately, then the entire product will be shaky. And, it's like it will break down your car, and that will be a risk to the driver as well as the passengers who is driving. So that's a crucial part I'm handling in the product development phase. And we are as Varun said, that we are basically into a RCM business, that is revenue cycle management and the life cycle business. And we start from the medical coding, that is the start, and medical coding, then the payment posting, then the charge entry and the payment posting, and then the account receivable. So these are the four main phases of the RCM that we cover as an entire life cycle. As well as the GeBBS is into the both the domains of the healthcare in the US, that is at the provider side as well as the payer side. So provider side is we are doing all this, the four products that we have said. And at the for the payer side, we have the product called the ICRA, that is a risk adjustment coding platform, which enables the insurance company to assess the risk of a patient, and based on the previous history, and by looking at the trend, they can assess what can be the impact on their revenue or on their budget for the upcoming years or for the next year, so that they can plan for it, as well as they can define the particular patient risk, the population at a risk category, and accordingly they can define the premiums too. So that's how GeBBS is catering to the three dimension. One is the provider, second is the payer, as well as the technology, which enables to seamless execution for both of them.
You, Varun, you presented your innovation in health category in front of the jury. Can you just deep dive little on the innovation?
Yeah, so as Amar mentioned, we are providing solutions around RCM industry. So we have coding solutions, and one of the product which I mentioned over there is risk adjustment coding solution, and this is typically for the US payer market. This is for the insurance. So this product helps to basically provide insights to the insurance companies about the risk profile of their patients, and at the same time they also provide insights into how the healthcare providers, basically the doctors, are performing, and how they're, and whether they need to be educated on the way they need to perform their services to the patients. So these are the two basic objectives of this product. Um, And then we have auditing product, because once you do coding, we call it medical coding, you have to audit whether it has been coded correctly or not, because the code directly are getting claimed from insurance companies. So there is a direct revenue impact of what you actually code in the system. So the auditing helps you to identify whether you have overcoded or undercoded, and how much accurate you are, your coders population is, and your and what is the level of accuracy for your at different code sets. So this is not just about accuracy and providing that insight. This is also a mandatory requirement from the US government that certain set of samples needs to be audited over a period of time. So this product helps you to achieve that as well.
There is a lot of need for innovations and solutions in healthcare. And so, what are the challenges that you faced during your journey from mine to marketplace?
Yeah, so initially, always in a product development, the challenge is to understand the business requirement um, at the first go. I mean, this is the biggest challenge. And once now, the advantage which we had as GeBBS Healthcare was that we were already doing these services, providing this healthcare services to the US clients. So we knew the business well. That in order to build a product around these services, we knew most of the requirements. So now, once we started developing, then the challenge came of how usable the product has to be, usability aspects, the performance aspects, the reporting aspects. I think most important was the reporting aspect. Now we have so much of data in the product, how we can best produce the reports and the dashboards to the end client. And then in order to put it in our market, we have to also understand what the other products are doing, because we have these products, other products already working in US markets. So we did that comparison, and we found that the advantage which we have to develop is, first is setting up the product, the implementation, where we reduce the time to a level where clients find it very convenient to go for a product, because the day we start off it and the day they start using is quite less as compared to the other product. And it has been a very template driven product, so you can define as many templates as we want in the same product, so that the customization part is taken care of. Clients always want customization, but many of the other products in the markets, they are not very open about customization, and they want people to use it as is. But here we are very open for customization. And the third aspect is we are continuously innovating it so that it is marketable for future. So one of the things which we are working right now is on the computer assisted coding part. So where the system is actually, and reading the data and providing the codes, and that reduces your time to process the data, and also increases the accuracy over a period of time. So that's where we are actually working towards to make our products more better in the market.
Thank you, Varun. GeBBS has come to Aegis Graham Bell Awards for the first time. You're participating for the first time. How you feel coming to the platform?
I think it's a very nice platform to be a part of it. Um, we have seen a lot of, nowadays, I mean, there's a lot of product development which is happening, and I've been part of a lot of presentations, and they have been very nice. And I think Aegis is providing that opportunity, especially to companies which are inclined towards innovation and product development, to at least present their thoughts, and to present their product and their thought process and what they plan to do in future. And yeah, it feels really good to be part of it.
Amar, you want to add on something?
I mean, Aegis is doing, I mean, just holding a finger of, the innovator to put it across to the, I can say, the globe, okay, to instead of keeping an idea that a person has, Aegis is, giving an opportunity to portray them to the world. And you never know how that idea or that innovation can be converted into a storm, and can definitely change the entire world.
Thank you.
So, thank you, Aegis.
Any words of wisdom for the innovators who are watching you?
Yeah, I would say that um, you know, just working on a process is very easy, or is more you know uh, working on a process is just like, you're just following certain steps, but always thinking of bettering those things, and making it more efficient and more effective is something we should always think of. And I think innovation in the form of automation is something which can really do that. And I would ask everybody to start thinking more than what they are doing right now, and think how they can make their process more effective.
Amar, you also have been a part of the process. Something that you want to share on your experience.
Yeah, I mean, so always you need to ask the question to yourself is what next, what next. So if you come up with an idea and laid some foundation to your innovation, so that doesn't hold you in enlarging your thoughts, or giving the dimensions to the thoughts. So always think about what you have in your mind, with experimenting by doing analysis, doing a market study that you can expand your thoughts to. So that is most important. You should not, you just not think, you just need to put into a paper. A documentation is very good, the critical parameter of the entire innovation, because what you think, you may get forget maybe in the, down the line, a week, a month, or a year back. But if you have any a proper documentation, then that will encourage to evolve
So
better.
proper
Yeah,
follow
proper,
design, and
yeah.
get everything right at the first place itself
Yes.
before you think of a product to come out.
Yeah.
That's what he wants to say.
Yeah.
Thank you, Varun. Thank you, Amar. And we wish the entire team of GeBBS all the good luck for the title.
Okay,
Thank you for
thank
coming
you.
here.
Thank you.